قل للمؤمنين يغضوا من أبصارهم ويحفظوا فروجهم ذلك أزكى لهم إن الله خبير بما يصنعون وقل للمؤمنات يغضضن من أبصارهن ويحفظن فروجهن ولا يبدين زينتهن إلا ما ظهر منها. तर्जुमा, ये सूरह नूर की आयत नंबर 29 और 30 का पाठ था. इसका तर्जुमा है, कहो मोमिन मर्दों से कि नीचे रखें अपनी नजर और हिफाजत करें अपनी शर्मगाहों की. ये तरीका ज्यादा पाकीज़ा है उनके लिए. बेशक अल्लाह पूरी तरह बाखबर है उन बातों से जो वो करते हैं. और कहो मोमिन औरतों से कि नीचे रखें अपनी नजरें और हिफाजत करें अपनी शर्मगाहों की और ना जाहिर करें अपने बनाव सिंगार मगर वो जो खुद जाहिर हो जाए. सदक़ल्लाहुल अज़ीम.
जज़ाकल्लाह प्रोफेसर राशिद साहब, बहुत शुक्रिया. बिस्मिल्लाहिर्रहमानिर्रहीम. आज हम आज के पीएमए के इस 70 वेबिनार का आगाज करते हैं और इसका सेहरा मैं पीएमए के साथ साथ प्रोफेसर सलमा कुंदी को दूंगा कि जिन्होंने पिछले 3 साल से इस प्रोग्राम को माशाल्लाह बाकायदगी से भी चलाया और मुझे भी पाबंद किया कि अभी मैं भी जहां दुनिया के जिस कोने में भी होता हूं तो इस वेबिनार को कंटिन्यू कराता हूं. मशकूर. इस प्रोग्राम की जो कोलैबोरेशन है, हमें पाकिस्तान एसोसिएशन ऑफ पैथोलॉजिस्ट और पीएमए और वुमेन मेडिकल कॉलेज एबटाबाद, पाकिस्तान फिजियोलॉजिकल सोसाइटी और इसके साथ हमारे दूसरे कोलैबोरेटर भी हैं. तो मैं आज के यंग स्पीकर और बहुत ही खूबसूरत टॉपिक डॉक्टर अब्दुल्ला काजी, ये पीएचडी स्कॉलर हैं लेकिन बहुत ही तालीम याफ्ता हैं. प्रोफेसर सलमा कुंदी की ये दरियाफ्त हैं. Over to you, Dr. Abdullah Qazi.
Thank you very much, Dr. Mulazim. It's my pleasure to be here. And I'm going to talk in English today because my supervisor is also here. So, Wadeed, can you please share my presentation?
Sir, I'm logged in with a cell phone. I've allowed you to share it.
Abdullah, the other device that you're using, mute that device and share it from that device. Because that device has something wrong with the audio.
Okay, give me 1 minute then.
आवाज नहीं आ रही, आवाज नहीं आ रही.
जी मैं लॉग इन कर रहा हूँ दूसरे डिवाइस से. जस्ट 1 मिनट.
वैसे वदीद आप तो शेयरिंग कर सकते हैं, आपने क्यों नहीं की? आप अपना दूसरा डिवाइस वदीद ऑन कर दें क्योंकि आपकी तरफ से मसला नहीं था, अब्दुल्ला के लैपटॉप से मसला है.
मैम लॉग आउट कर दिए, मैं लॉग इन करता हूँ उसमें.
I hope you can see my screen now.
Yeah, we can. Thank you.
Can you all hear me properly?
Yes, we can.
Okay, sorry for the delay. The topic that I'm going to be presenting today is the career barriers and enablers female doctors face in Pakistan. So my name is Muhammad Abdullah Qazi. I'm currently the head of department in the Department of Medical Education and Research, Women Medical and Dental College. I am a PhD scholar in the University of Dundee, UK, and this is my topic for my PhD studies. So right now I'm in my final year of PhD. I've done my data collection, I've done my analysis, and right now my thesis is in the review process. So hopefully I will be defending this thesis soon, inshallah. So let me give you a background of the female medical students and doctors in Pakistan. It has been estimated that around 70% of all medical students are female in Pakistan, and half of them do not continue after graduation. It has also been estimated that around 85,000 female doctors have already left work. There is a shortage of physicians in the country, which is often being blamed on female doctors. So you'll find many newspaper articles citing that the female doctors leave the profession, therefore there is a shortage of physicians in the country. There is lack of female doctor representation on leadership positions worldwide. And in Pakistan, there is a lack of evidence on female doctors representation in different positions, departments, and the career barriers they face in Pakistan. You will find some studies, around 3 or 4, which explore the career barriers and enablers that female doctors face, but not many. And there is limited evidence on the attrition of female doctors in the country, not just female doctors, but also male doctors, but because we know that there is the phenomena of brain drain in Pakistan as well. So me and my supervisors, we worked on this paper, which we published in the Journal of Pakistan Medical Association. And this paper is about the career barriers and enablers female doctors face. It's a narrative review, and it points out the literature gaps that we have within the context of Pakistan. So because we had a literature gap, we didn't have a lot of evidence regarding this issue within the country. So we looked at other countries, what their evidence tells us, and what interventions they've been putting in place to help female doctors progress in their careers. So this narrative review paper identified some key areas, and it identified that there was unequal representation of female doctors in leadership positions. And I'm talking about the world, not just in Pakistan, because as I said, in Pakistan, we have a lack of evidence regarding the representation of female doctors on different positions. And then it identified that there are work-life imbalances that female doctors face, socio-cultural norms, and lack of professional development opportunities. So my PhD study aimed to address 3 basic research questions. Number 1 was, what is the ratio of female doctors working as undergraduate academic faculty in different positions in Pakistan? Number 2 was, what are the career barriers and enablers facing female doctors in Pakistan? And finally, why do some female medical students continue and some not continue their career after graduation in Pakistan? We gained ethical approval from the National Bioethics Committee, Pakistan, as well as the School Research Ethics Committee in the University of Dundee before starting my project. So just an overview about the methodology of my study. It was a mixed method study, utilizing both quantitative and qualitative methods. It utilized pragmatism paradigm, what will work best to answer the research questions. And it was divided into 2 phases. As I said, it was there was one aspect of quantitative methods and the other aspect of qualitative methods. So I divided it into two phases. Phase 1 referred to quantitative data collection and analysis, and phase 2 qualitative methods. In phase 1, which was the quantitative methods, I collected retrospective secondary data from PMDC online database, which included faculty registration lists of medical schools, medical schools in the country. Data of 18,495 doctors registered in 2018 as undergraduate medical faculty for 102 medical schools was compiled and analyzed. During the time of data collection in 2020, there were 114 medical colleges registered in Pakistan with the PMDC, but the data was only available for 102 medical schools. Descriptive statistics on SPSS 22 was used to explore ratios of male and female doctors in different positions and departments. So I would like to share some significant findings of my study with you. So this figure, it shows the ratios of male and female doctors in different positions of seniority in Pakistan. And this data, it refers to the undergraduate faculty. So the faculty members, the doctors who are teaching MBBS program in the country. So starting from your left-hand side, you will see the most junior position, which is lecturer, demonstrator or registrar. You will see that there are higher number of female doctors on this position. But as you go up the ladder from junior to senior positions, you will see that the representation of female doctors start to decrease. It's almost like a trend that, you know, going from the junior to senior positions, female doctors ratios tend to decrease, whereas male doctors, they tend to increase. So we found that, for example, on the lecturer position, lecturer, demonstrator or registrar position, we had 56% female doctors working, whereas 44% male doctors. And on the most senior position, you will only find around 6% female head of the institute or principal. And if you look at the professor, you will find that there were only 23.2% female doctors out of the total. Now, this figure looks at the ratios of male and female doctors in clinical and non-clinical departments. In non-clinical departments, female doctors, they outnumber their male counterparts. Whereas in clinical departments, you will find that the male doctors are significantly higher than their female counterparts. This figure, it explores the ratios of male and female doctors in different departments in Pakistan. So it's not surprising, but my study found that in gynae and obs, the majority of the doctors were female, followed by the Department of Medical Education. And then I clubbed basic sciences together, pre-medical sciences together. So then we found that in basic sciences and pre-medical sciences, female doctors were higher in number compared to male doctors. But in all other clinical departments, for example, we have pediatrics, medicine, ophthalmology, surgery, ENT. The female doctors are lower in number than their male counterparts. So phase 1 was about exploring the ratios of male and female doctors. And in phase 2, we explore some phenomena in depth by conducting a case study in Ahmedabad. In this case study, 42 semi-structured interviews were conducted using the principles of narrative inquiry. Purposive sampling was used in 4 medical colleges and their affiliated institutes. So we have 4 medical colleges in Ahmedabad. 1 is public sector, 3 are private sector medical schools, 1 is female only, 3 are co-educational. So the participants were from all these 4 medical colleges as well as their affiliated hospitals. The participants did not just include male and female medical students and doctors, but also the relatives of female doctors and students. And the reason for exploring the perspectives of the relatives of female doctors and students was that in the previous literature, there are a couple of papers that suggest that there is an influence of, family members, especially sometimes parents, sometimes in-laws. They have an influence on female doctors, especially after they get married. So after they get married, there's an influence by the in-laws. Before they're married, their parents have an influence on their career. So Braun and Clark's 6-phase thematic analysis framework was used in NVivo 12 to analyze the data. So this table, it shows the characteristics of the participants in phase 2 of this study, which was the qualitative phase. There were a total of 28 doctors were interviewed, 15 were female, 13 were male. Out of these 28 doctors, 20 were working, 11 female, 9 male. I also interviewed some doctors who were on a career break, and there were different reasons for them taking a career break. There were 8 in total, 4 female and 4 male. And the reason for including them was to explore the reasons for them not continuing or taking a break in their career. I also interviewed 8 doctors who were in leadership position, and by leadership position, I mean participants who were either the head of department, director, principal, vice principal. I also interviewed 10 medical students, 7 female, 3 male, and 12 relatives of female doctors and students. So this figure shows you a brief description, or I can say, a snapshot of the career barriers and enablers female doctors face. And I have categorized these career barriers and enablers using the relational framework for diversity management by Sayed and Osbilgin. So I found that this framework rightly categorizes the themes that were identified in my study. So we can say that the career barriers and enablers that female doctors face, they lie on 3 levels. These 3 levels interact with each other, and the barriers and enablers are multifactorial. So on the personal and family level, we have domestic responsibilities that female doctors have to face. And it can become a barrier or an enabler if domestic responsibilities increase while female doctors are working. Then it puts a burden on the doctor, and it can affect their career progression. And if obviously the domestic responsibilities are shared, then it can help those female doctors focus on their careers more. Then another major factor which was identified in the personal and family factors category was marriage and children. Again, this factor is associated with domestic responsibilities, because after marriage and having children, usually the domestic responsibilities for female doctors, they increase. So the third factor that we have is the support system. And by support system, the most important support identified in my study was that of the husband's support after marriage, the in-laws support, and before marriage, it was the parents' support that was found to be the most instrumental in terms of female doctors' career progression. And then motivation and interest. In my study, many participants thought, and many participants themselves acknowledged, that they were influenced by their parents to join undergraduate medical education. Some people said that we were forced by our parents to join this profession, and that they did not want to join it, and they might leave it after graduating, and they were doing it to fulfill their parents' wishes. So in my study, I call this external motivation, that you are being influenced or forced by your parents or other family members. And I call internal motivation the motivation which is fostered through your own personal interest. You know, some people said that we want to pursue this career because we want to serve humanity. Some people said I would love to do surgeries in the future. So that was internal motivation. So that is another big factor that plays a role in the career progression of female doctors and medical students. Organizational factors, the biggest factor that was identified in this category was work-life balance. Again, as I said, these factors, these levels that I'm describing, they are overlapping. So work-life balance, it has an association with domestic responsibilities as well. So obviously, if the domestic responsibilities increase, then it will affect work-life balance. And there's another factor to it, which is the workload that you have to face in the workplace. So if doctors, if they have a good work-life balance, then they're able to progress more smoothly, I would say, in their career compared to those who cannot achieve that work-life balance. Then the second factor was gender imbalance. And by gender imbalance, I mean, like I described in the first phase of my study, we have a higher number of female doctors on the junior positions. And as we progress to senior positions, we have fewer female doctors compared to male doctors. So we have gender imbalances in positions of seniority. And then I showed you another figure which showed that we had gender imbalances in different departments. We also had gender imbalances in clinical and non-clinical departments combined. So it was found in my study that this gender imbalance, it affects female doctors' career progression. For example, many female doctors in my study, some said that we wanted to pursue surgery as a career. However, we couldn't do it because it's male dominated. There are many male doctors in that field, so we might not be able to do it for one reason or the other. The third factor which was identified in organizational factors was role models and mentors. And this again refers to what I said about fewer female doctors being on leadership positions. So it was found that there was in institutions in Pakistan, we lack mentorship programs, structured mentorship programs, especially for female doctors. And there was another aspect to it. It was networking opportunities. There was a lack of networking opportunities within the Pakistani context, identified by the participants in my study. There was gender discrimination. Many participants talked about it. They thought that sometimes female doctors are not encouraged to get promoted sometimes. There was sexual harassment, which was, some participants told me that they've been subjected to sexual harassment themselves. And the biggest problem that they were facing was that they did not want to file the case. So many cases of sexual harassment, they go unfiled. They're not reported. There is no fixed mechanism in institution, according to the participants, that addresses these cases. So we'll talk about that in the next slides as well. And then there was a lack of professional development opportunities within organizations. So in the wider factors, on the national level, we find that there is a shortage of doctors in the country. And it is a barrier for doctors who are working in the country, because they feel that when there is a shortage of doctors, then it puts more increased work on the doctors that are in the system, that are currently working. And many doctors, I was surprised that many doctors talked about job opportunities. And this was an issue after doctors complete their house job. And there was one particular doctor who said that he's looking for a job. And this was a problem in terms of rural and urban areas as well. So doctors said that they find it difficult sometimes to find a job close to their home, especially if they're living in a rural area, if they are female doctors and they want to work close to their home so they can travel safely to the workplace and then back home. Sometimes it's difficult for them to find a job. That's what many female doctors as well as male doctors identified. Then many participants talked about the wider community perceptions. And by wider community perceptions, the participants meant that sometimes when we're working in the hospital, we feel like we are not considered competent compared to our male counterparts. People feel that male doctors are more competent. Some participants said that, they were asked if they can call a male doctor while they were at work. So although many participants said that, medicine is considered to be a good profession for female doctors, it is accepted by the society, medicine and teaching. However, once they go into the field, they feel like the community does not accept them how they accept the male doctors. Gender equality, and then marriage market. I'm sure all of you have heard about this, and it has been identified many times in the newspaper articles that I have referred to in my work. And there's an issue described by many people here. There's a perception that many women, they pursue undergraduate medical education, they do MBBS, or their parents force them to study so they can get married to a better place or good marriage proposals. So to conclude, my study found that there is an imbalance of female doctor representation on different positions and departments in undergraduate academic medicine in Pakistan. Female doctors are higher in number on junior positions as compared to senior positions, with significant differences. Female doctors are higher in number in non-clinical compared to clinical departments. There are marked imbalances from one department to another within clinical departments, sorry. Female doctors face multiple barriers on different levels, which restrict their career progression. So in this presentation, I'm focusing on the organizational level recommendations because most of you work in different organizations, and I hope that this study will help shape the policies regarding the career progression of female doctors. So the number one recommendation in my study is that there should be flexible and family-friendly policies in the workplaces, because it is a global trend and it's been named as feminization of medicine. It's a global trend that female medical students and doctors are increasing throughout the world. And other parts of the world, they are preparing themselves to facilitate these female doctors so they can progress in their careers. And in other parts of the world, they've introduced flexible and family-friendly policies, which have proved to be beneficial for their career progression. This includes childcare facilities within the workplace, and we also have an act. We have a law in Pakistan that every institution must have childcare facilities. There should be adequate leave policy and flexible work options like part-time online opportunities. We should aim to tackle gender discrimination, and it can be done through unconscious bias training. We need to address sexual harassment through awareness campaigns. We need to define processes for filing and acting on those complaints. We should introduce structured professional development, mentoring, role modeling, and networking opportunities for female doctors. And there were suggestions to introduce mandatory work for doctors after graduation. And this was to reduce the attrition of doctors in the country after they graduate. We should assess the level of motivation and personal interest in medical candidates during admissions. And I also have some recommendations for future research because, you know, this topic I feel is very important in the Pakistani context, and we need to do something about it. And I feel that we do not need to stop female doctors from getting admission into medical school, but we need to look for ways to help them progress in their careers, because I feel like it's a global trend and we need to be prepared for the future. There is a lack, as I said in the background of the study, there is a lack of evidence in the Pakistani context regarding the career barriers and enablers the female doctors face, as well as their ratios on different positions and how they progress. There is no longitudinal studies which seek to understand the career progression of female doctors. We can explore the number of female doctors leaving the medical profession and those rejoining after taking a career break. So even though we have many newspaper articles saying that a number of female doctors leave the medical profession, and I also quoted one such article in the background, which said that 85,000 female doctors have already left work. However, we do not know the source of that information, and there is no concrete data on the attrition of male as well as female doctors in the country. So that can be explored. We can explore internal and external motivation to pursue medical career. Again, I've explained what internal and external motivation is in my study. Gender wage gap has not been explored, and this was out of the scope of my study as well, so that can be explored. And there is one recommendations for institutions such as PMDC, CPSP, healthcare commissions in all the provinces, that they should make public the data regarding the progression of female doctors, so that researchers can, it is easier for researcher to examine that data and to explore it and to see how female doctors progress within the context of Pakistan. So these are the references. And thank you very much. Any questions?
Thank you very much, Dr. Qazi Saab. If anybody wants to ask a question, raise the hand. Qazi Saab, I have one question.
Ji.
Okay, how can you say that this is the discrimination between males and females nowadays in our all medical institution? There are, I think, more than 2/3 are females and 1/3 are males. How can you will justify it?
Sir, in my quantitative study, you can see that female doctors are higher in number on the junior position and lower in number in the senior position. In the qualitative phase, because this study is based on social constructivism.
Start video. Okay.
And in social constructivism, you explore the perspectives of individuals. In my second phase of the study, I explore the perceptions of male as well as female medical students, doctors, and those doctors who are on leadership positions. So I have a diverse group of participants. This theme emerged from the data that was collected in the qualitative phase of the study. Hope that answers the question.
There's no question.
May I ask a question?
General Aslam Saab has a question, and then I will
Okay,
also
sir.
have a question.
Okay, you can ask the question.
Thank you very much. Dr. Qazi, thank you very much for your PhD project. I will have questions.
Welcome, sir. Jana Saab, welcome, sir. You are always with us, sir.
Thank you. In your capacity as a PhD scholar, like you're using the words as non-clinical and clinical departments. Non-clinical is an obsolete word in the world of health sciences, according to the recent. You are from Dundee, you are doing from Dundee, which is a hub which made by Professor Arden. So non-clinical in health sciences is an obsolete term now. So can you change it into preclinical or paraclinical versus clinical studies? Because the outcome of all these subjects or discipline is the patient's care, patient welfare. That is one. My second concern would be, as a PhD scholar, in the recommendations, you are using the word unconscious bias training. Like, say there's no training in unconscious.
Yes, we do not accept.
It is subconscious. It is subconscious bias training. And my point of view would be, I am glad you put it as number one in your recommendations about the flexi hours or part-time facilities. So the government should pursue, and the private sector should pursue with the female gender to give them liberty to have flexi hours or part-time training, which will increase their activism and professionalism for the female. And I do agree with Dr. Bukhari, gender discrimination, generally, we do it one way. Now, male are also harassed as well in some cases. Thank you very much.
Thank you for your
Dr. Sharma
suggestion.
Kodi?
Yes, can I take it from there? I agree with General Saab, General Aslam, because I was thinking on the same lines. Actually, the girls should have flexible hours of work, even in our pre-clinical setting. But we have to convince the PMDC for this.
That's
Because
true.
the PMDC goes and it looks into our biometric record. So even the ladies have to come at 8 a.m. and they have to leave at 3 a.m. and they check the biometry. That is our only hindrance. Otherwise, every institution would like to facilitate these ladies. Like we made a daycare in our college for them, but we don't know how to move around those hours. If we tell them to go home and then later commute back to the college for the timing in and timing out, that too is illegal and it's a bit strenuous for the lady involved. So please let us brainstorm and come out with a feasible solution to this problem.
Right.
And it was a very nice piece of talk by you, Abdullah, because I will not give you my vote of thanks. I would request Mulazim Saab to ask Dr. Kazi Wasik to do that. Dr. Aslam Saab, you were saying something?
I'm not talking for the students, I was talking for the female doctors, that the government should and the private sector should provide provisions for flexi hours working and part-time facilities to work, keeping compromisation on the scales of the pay. That was I was talking about.
I too was not talking about the student. I was talking about the female teachers that we have,
Yeah.
the demonstrators, the lecturers, the
Yeah.
assistant professors, etc., etc.
Yeah.
Thank you.
I
Thank you so
second,
much,
I
Dr.
second
Wajid Qadi. Dr.
that
Qadi
in
Saab. Dr. Qadi Saab,
Ji, ji.
Wasik Qadi Saab. I think Professor Dr. Qadi Saab, your mobile is Madam.
I don't know.
Dr.
I can't see
Qadi
him now.
Saab is
Okay.
not responding.
Can I give the vote of thanks then? Abdullah, you wanted to say something?
Okay. No, over
was
to you, madam.
that
For good of them.
I was saying that I do second what you were saying about how we can provide, flexible job opportunities for female doctors. PMDC requires private institutes that every male as well as female doctors, they follow, their biometric attendance rules, which says that you have to come at 8 in the morning, leave at 3 in the afternoon. So, that is one hindrance. And I would also like to talk about online education. I feel like, and in my study, it was identified that female doctors do benefit from online education. However, in Pakistan, it is sometimes not accepted. Sometimes it is hard to get it registered with the PMDC if you've completed an online education. So we also need to work on that.
Actually, I'm very happy. I was very happy with the online education. Our college was the pioneer in online education during the Corona era in KPK, and we did very well. But before my vote of thanks, I'd like your supervisor, Dr. Kate, to say a few words if she wants to. Dr. Kate, are you listening to us? Kate Kennedy.
Yes, I am. Thank you very much. Yes, I would just like to say congratulations, Abdullah. I think you've done a fantastic study. And I think, what your research has demonstrated is that making information more accessible and doing studies such as this can really inform the future workforce issues and hopefully improve the situation in Pakistan in terms of the ability of women doctors to work and alleviate some of the workforce issues that are being experienced. So congratulations, Abdullah. I think you did a wonderful presentation. And I look forward to seeing you defend your thesis.
Thank you.
Thank you. Thank you,
And
Dr.
thank
Kate.
you very much. Thank you very much, Qadi Saab. Excellent presentation. and we all encourage, we senior encourage you, and we will also advise other peoples like you to conduct such type of studies where these issues about the females should be settled down, especially at their workplace. Thank you very much. My prayers for all of you from Mashhad Muqaddas, from the Haram Imam Raza alayhi salam. Allah Ta'ala आप
Ameen.
सबको खुश रखे, Allah Ta'ala आप सबको सलामत रखे. Pakistan.
Thank you very much, sir.
Thank you so much.
Remember us
Allah
at holy
bless you.
places.
Thank you. Allah Hafiz.
Allah Hafiz.
Yes, Allah Hafiz.
Allah Hafiz.